Medication administration. A medication is any compound that changes the chemical activity within the human body. There are two types of medications. Legend drugs can only be dispensed with a prescription. Non-legend drugs can be purchased without a prescription, also known as OTC medications. A prescription is an order for medication or treatment given by an authorized healthcare professional with specific instructions for use. Healthcare professionals who can give prescriptions include doctors, nurse practitioners, physician's assistants, or dentists. Medications have two names you need to know. Generic name. Brand name. Scheduled medications are called controlled substances. These medications could be dangerous or have a high potential for abuse and addiction. Examples are narcotics, depressants, stimulants, and psychedelic medications. Medications do three main things. 1. Treat, cure, or control an illness. 2. Relieve symptoms like pain. 3. Prevent disease. 6 personal characteristics can affect a medication's action. 1. Age. 2. Size. 3. Sex. 4. Genetic inheritance. 5. Physical condition. 6. Emotional condition. Other factors that might affect response to a medication are: route of administration, time of day the medication is given, number of medications a person takes and size of dose, environmental conditions. Medication side effects are unintended effects of medications on the body that are not part of the goal of medication therapy. Examples are dizziness, headache, insomnia, nausea, and upset stomach. A medication interaction occurs when the administration of one medication given before, at the same time, or after another medication alters the effect of one or both medications. The effect of one or both medications may be either increased or decreased. An allergic reaction happens when the body's immune system reacts to a medication in a way that causes the body to produce chemicals that cause itching, swelling, muscle spasms, and can lead to throat and airway tightening. The reaction can range from mild to life-threatening. 7 routes of medication administration are: oral taken by mouth and swallowed, sublingual placed under the tongue, topical applied directly to skin or mucous membrane, rectal inserted into the rectum, vaginal inserted into vagina, inhalation sprayed or inhaled into the nose, throat and lungs, injection piercing the skin with a needle and putting medication into a muscle, under the skin, or into a vein. The most common packaging types for medications are vials or bottles, bubble packs, medication organizers, unit dose packaging. All labels should contain the following information: client name, medication name, dose, route, schedule, expiration date. There is a legal difference between medication assistance and medication administration under nurse delegation. In medication assistance, you are helping the client to self-administer their medication only as much as they need to complete the task for themselves. The client is aware that they are taking medication. In medication administration under nurse delegation, you are administering the medication as delegated by the RN. Only NACs/NRs under delegation can perform medication administration. If the client cannot put the medication in his or her own mouth or apply it to his or her own body, or is not aware that he or she is taking medication, the administration of the medication must be delegated. Medications are given using the 5 rights of medication administration. Right client, right medication, right dose, right route, right time. There are 5 steps the medication administration process. Step 1: evaluate the client. Step 2: set up the medication. Step 3: administer the medication. Step 4: document the medication administration. Step 5: observe the client for side effects. Individuals have the right to refuse medications or treatments. Individuals have the right to privacy when medications are administered. Always take care to ensure the person's privacy. This includes privacy of medical records and health information. Discuss the following special situations with your delegating RN so that you are prepared to handle each one. The client declines a medication. You make or discover a medication error. Medication storage. Medications should be stored in original containers, with the legible, original label. Non-refrigerated medications should be kept in a dry place, not warmer than 85 degrees Fahrenheit. Refrigerated medications should be stored at 35 to 50 degrees Fahrenheit. It is safest to keep refrigerated medication in a Ziploc-style plastic bag or other leak-proof container such as a locking mental tackle box. Be sure to separate refrigerated medication storage from food storage. If you work in a facility, follow the policy where you work regarding medication storage. When a medication is discontinued, it needs to be disposed of. Ask the client, or representative, how he or she would like you to dispose of the medication. If you work in a facility, always document the outcome when you dispose of medications. You and the witness must sign the medication disposition form.